Welcome to the reconnaissance briefing. Today, we're asking something pretty fundamental. What if mental illness? What if it isn't just about your mind, but actually about your brain? We're diving into this revolution in brain health, moving away from these abstract labels towards, actual physical brain issues you can see and maybe even treat.
That's precisely it. For decades, psychiatry was seen as a bit of a soft science.
Right.
Because, well, we weren't really looking directly at the organ. We were trying to help the brain.
Yeah.
But imaging technology, it changes everything. It's helping turn this into a hard science. You can actually see structure, see function. In fact, at Amen clinics, we've gathered, I think it's over 225,000 brain scans now.
Wow, that many.
Yeah, it's the world's largest database. It gives us incredible insights.
That's fascinating. So, okay, if imaging is key, tell me about SPECT. What is SPECT exactly? How is it different from, say, an MRI?
Good question. So SPECT, that's single photon emission computed tomography, it looks at function.
Function?
Yeah.
How it works?
Exactly. It measures blood flow and activity. So we can see areas that are working too hard or maybe not enough, or areas that look healthy. An MRI that shows structure, it's great for finding like a tumor or a bleed.
Yeah.
But it doesn't tell you how that part of the brain is actually firing.
So MRI is the anatomy, SPECT is the activity.
Think of it like this. MRI shows you the roads. SEC-T shows you the traffic on those roads.
Oh, okay. That makes sense.
And this gives us really personalized insights. We had a scan, for instance, of Kendall Jenner after she had COVID. Her scan showed significant inflammation, like right in the anxiety centers of her brain. An MRI wouldn't pick that functional detail up.
Wow. And that explains symptoms way beyond just saying anxiety.
Precisely. Or take Andrew, a patient whose aggression seemed inexplicable. Turns out he had a cyst putting pressure on his brain. Talk therapy alone would have missed that completely.
That's incredible. So the scanning, it can really uncover underlying physical causes. How does this then help us understand something like, happiness or even ADHD?
Well, happiness, or maybe the tendency towards negativity, we often see that linked to activity in the front part of the brain, the prefrontal cortex.
Okay.
Low activity there.
Right.
Often correlates with feeling unhappy, more negative bias. We can literally see it.
You can see unhappiness patterns.
We can see patterns associated with it, yeah.
Yeah.
And conditions like ADHD. It's not just one thing.
Right, I've heard that.
Our research suggests there are at least 7 different types of ADD. And the standard treatment, stimulants, might help one type, but actually make another type worse.
That's crucial. So a symptom-based diagnosis could lead you down the wrong path.
Absolutely. And sometimes the answer is quite different. We did a study where putting kids with ADHD on an elimination diet, removing gluten, dairy, artificial stuff, helped 70% of them.
70%, just from diet.
70% saw significant improvement. It shows how much physical health impacts brain function.
It really does. So if we want to protect our brains, what are the main threats? You mentioned the Bright Minds framework.
Yes, Bright Minds. It's basically an acronym, makes it easier to remember. It covers 11 key risk factors that can harm your brain, but are often preventable or treatable.
11 factors. Okay, can we touch on a few key ones?
Sure. Let's take B. That's blood flow, super critical. Poor blood flow equals poor brain function. Simple as that.
Makes sense.
Then T is for toxins. Obvious ones like alcohol, marijuana, they definitely age your brain, reduce blood flow.
Right.
But also less obvious things. Like, did you know even a single dose of general anesthesia has been linked to increased risk of learning issues in kids or dementia later in life?
Seriously, anesthesia.
Yeah, something to consider. And M stands for mental health issues. A big focus here is AC's adverse childhood experiences.
Ah, yes, trauma.
Exactly. Chronic stress from things like abuse or neglect, it can literally change the brain, hyperactivating the emotional centers.
Leading to that negativity bias you mentioned.
Yes, and it doesn't stop there. High ACE scores are linked to higher risks for the leading causes of death decades later. It's profound.
Wow. Okay, so understanding these risks is huge. But what can we do? What are some targeted ways to improve brain health?
Well, one foundational thing is cognitive. We call it killing the ANTs, automatic negative thoughts.
ANTs, like insects.
Yeah, sort of. It's about identifying and challenging those negative thoughts that just pop into your head automatically, training your brain to be more positive and rational.
Okay, cognitive restructuring.
Exactly. For trauma specifically, EMDR, eye movement desensitization, and reprocessing can be incredibly effective.
I've heard of EMDR.
We see it calm that diamond pattern of trauma activity on scans. There was a study with police officers with PTSD, EMDR, significantly improved their brain function.
That's powerful. What about lifestyle things, maybe supplements?
Absolutely. Omega-3 fatty acids are fundamental building blocks for the brain. Can't recommend them enough.
Okay, fish oil and things like that.
Yep. Saffron is another interesting one. Studies show it can be as effective as some antidepressants for improving mood, but often with fewer side effects.
Saffron. The spice.
The spice, yes. And L-theanine, which you find in green tea, is great for promoting a sense of calm focus without making you sleepy.
Interesting. So targeted support. Now, what about differences? Do men's and women's brains look different on these scans? Does that affect maybe relationships?
Oh, definitely. We see clear patterns. Women often have, well, busier brains overall, especially in the emotional centers. This can contribute to more rumination, higher risk for depression and anxiety.
Busier emotional brains.
Yeah, and often healthier frontal lobes, too, better impulse control. Men, on the other hand, sometimes show lower activity in that prefrontal cortex.
So different strengths and vulnerabilities.
Exactly. And understanding these differences, it can be revolutionary for relationships. I worked with a couple, constant fighting. We scanned them, treated their individual brain imbalances. It completely changed their dynamic. They went from conflict to connection because they understood the brain reasons behind some of their struggles. It wasn't just about willpower.
That's fascinating. Understanding the hardware helps the software work better, essentially.
That's a great way to put it.
So wrapping this up, what's the main takeaway for someone listening? What's the crucial message for their own brain health journey?
The most important message is neuroplasticity. Your brain isn't fixed. It can change. You can make it better.
It can always change.
Always. So start by asking yourself this simple question every day. Is what I'm doing right now good for my brain or bad for it? Just that awareness is huge.
Good or bad for my brain? I like that.
Cultivate what I call brain envy. Want a better brain. And learn to question your thoughts. Don't believe every stupid thing you think. Sometimes I tell people to name their mind like Hermie the annoying raccoon who feeds you negativity.
Give it a name.
Yeah, it gives you psychological distance. You can say, oh, that's just Hermie talking again. It's about training your brain day by day for health and positivity.
That's really empowering. It sounds like taking care of your brain isn't just important. It's maybe the most important journey we can take for a better life now and in the future.
I truly believe it is.